They threw trash at his feet, called him just a janitor, laughed when he cleaned their messes. The 68-year-old man with the mop and bucket, invisible. But when the school bus crashed, when a 16-year-old girl was dying from brain bleeding, the janitor's hands moved like a surgeon's because he was one. Dr. Samuel Okafor, Harvard Medical School, 3,000 brain surgeries. The man they mocked, he saved her life, is his story. Part 1, The Invisible Man, September 2023, Riverside High School. Every morning at 6 a.m., Samuel Okafor arrived, 68 years old, gray hair touching his shoulders, dark skin lined with decades of wisdom, navy blue janitor's uniform, name tag Sam Custodian, and every morning the students walked past him like he was furniture. "Yo, janitor, you missed a spot." Laughter, a crumpled paper thrown at his feet. Samuel bent down, slowly, picked it up, placed it in his trash bag. "Have a good day," he said quietly. His voice carried a trace of a Nigerian accent, British-educated English, softened by years in America, but nobody listened, nobody cared. In the cafeteria, during lunch, 3 senior boys sat at a table. Pizza crusts, soda cans, napkins scattered everywhere. Samuel approached with his cleaning cart. "Excuse me, gentlemen. May I?" "Gentlemen," one boy mocked. "Dude, we're not gentlemen. And you? You're just a janitor. Clean it up. That's your job." The other boys laughed. One deliberately knocked his soda can onto the floor. "Oops, guess you got more work now, old man." More laughter. Samuel said nothing. He knelt down, wiped the spill, and moved on. But his hands were different. Long fingers, steady, precise, scars, thin white lines along the sides of each finger. Surgical scars, the kind that come from years of holding scalpels, years of cutting into human brains. But nobody noticed. In the teacher's lounge, one afternoon, Miss Rodriguez, the biology teacher, was drawing a brain diagram on the whiteboard. So the frontal lobe controls decision-making. Samuel was emptying the trash. He paused, looked at the diagram. "Excuse me, ma'am," he said softly. Miss Rodriguez turned. "Yes, Sam? The corpus callosum. You've drawn it, slightly posterior. It should be more anterior, connecting the hemispheres at this point." He gestured precisely. Miss Rodriguez stared. "How do you know that?" Samuel smiled gently. I read a lot. Medical books, at the library." That's actually correct. Thank you, Sam." She corrected the diagram. Samuel nodded and continued cleaning. Miss Rodriguez watched him, curiously. "Just a janitor who reads medical books," she whispered to herself. Part 2, The Crash, October 12, 2023, 3:15 p.m. The yellow school bus pulled out of the parking lot. 42 students, Route 7, heading to the north side neighborhoods. Driver, Mrs. Patterson, 23 years of experience. Everything was normal until 3:17 p.m. A red pickup truck ran a stop sign, 60 miles per hour, hit the bus on the passenger side. The sound was deafening, metal crunching, glass shattering, screaming, careened sideways, smashed into a telephone pole, and stopped, smoke rising from the engine. Inside, chaos, students crying, bleeding, trapped, the driver unconscious, and in seat 14, on the right side, where the impact hit hardest, 16-year-old Emma Chen. She wasn't moving. Samuel was in the school parking lot, loading cleaning supplies, when he heard it, the crash, 200 yards away. He dropped everything and ran, faster than a 68-year-old man should be able to run, his legs pumping, his heart pounding. "Not again," he whispered. "Please, not again." He reached the bus, pulled open the emergency door, climbed inside, students screaming, "Help us, I can't move my arm. Where's Emma?" Samuel's eyes scanned, training decades old, activated instantly. Triage, assess, prioritize. "You," he pointed to a boy with a bleeding nose. "Superficial, you'll be fine. Help others exit." "You," a girl with a twisted ankle. "Sprain, painful but not critical. Move to the front." "You," a boy holding his arm. "Possible fracture. Keep it still. Sit here." His voice calm, commanding, authoritative. The students obeyed. Nobody questioned the janitor, because suddenly he wasn't a janitor anymore. Then he saw her, Emma Chen, slumped against the window, blood trickling from her right ear, her eyes half open, pupils unequal, left pupil dilated, right pupil constricted. Samuel's breath caught. Intracranial hematoma, he whispered. Brain bleed. He moved quickly, knelt beside her. Emma, Emma, can you hear me? No response. He checked her pulse. Weak, thready, 90 beats per minute. Too fast. He lifted her eyelids, gently, shined his phone flashlight. Anisocoria, unequal pupils, increased intracranial pressure. He placed his fingers on her neck, felt the carotid pulse, blood pressure, dropping. A teacher, Mr. Harrison, climbed into the bus. Sam, what's happening? This girl has a brain bleed. Epidural or subdural hematoma. The impact ruptured blood vessels. Blood is pooling between her skull and brain. Pressure is building. She has 18 minutes before irreversible brain damage. Mr. Harrison stared. How do you know that? Samuel didn't answer. He pulled out his phone. Call 911. Tell them we need a neurosurgical team. Stat, trauma center, code blue. I already called. Ambulance is coming. How long? They said 20 to 25 minutes. There's traffic. 25 minutes. Samuel's voice cracked. She'll be dead in 18. Part 3. The choice. Samuel looked at Emma. Her breathing, shallow. Skin, pale. Cushing's triad, he muttered. Bradycardia, hypertension, irregular respiration. Brain herniation, imminent. Mr. Harrison grabbed his shoulder. Sam, what are you saying? You're a janitor. Samuel turned, slowly. His eyes, no longer soft, hard, focused. I'm not just a janitor. He stood. I need a first aid kit, scissors, clean towels, bottled water, gloves if you have them. And I need this space cleared. Now, Sam, you can't. I can. And I will. Because if I don't, she dies. Do you understand me? She dies. In his commands. Mr. Harrison hesitated, then nodded. Everyone out. Now, give him space. Students scrambled. Some stayed near the windows watching. Samuel removed his janitor jacket, rolled up his sleeves, his forearms, strong, veins prominent, and those hands, those steady hands. He opened the first aid kit, pulled out scissors, sanitized them with alcohol wipes. This isn't a sterile environment, he said to himself. No anesthesia, no surgical team, no imaging. He looked at Emma, her pulse weakening. But I don't have a choice. He positioned her carefully on her side, head elevated, 30 degrees. Reduce intracranial pressure, he muttered. He felt the side of her skull, right temporal region, a soft, spongy area, depressed skull fracture, bone fragments pressing inward. His fingers traced the injury. Hematoma, building here. A moment, and in his mind, he saw her, Amara, his daughter, 16 years old, on the operating table, 6 years ago. Another surgeon's mistake, nicked an artery, bleeding uncontrollable, and Samuel, watching, helpless, because it wasn't his surgery. He was just observing. Not again, he whispered. Please God, not another child. His hands trembled for just a second. Then they steadied. Years of training, 3,247 surgeries, took over. I need to decompress the hematoma, he said aloud. Manual decompression, emergency burr-hole procedure. He looked at Mr. Harrison. This is going to look frightening, but I need you to trust me. Who are you? Someone who used to save lives.
Part 4, 18 minutes, 3:23 p.m. Start. Samuel made the first cut through the scalp. Small incision, 2 inches. Blood welled up. He pressed a clean towel. Hemostasis, control the bleeding. Students outside the bus gasped. Oh my God, is he cutting her? What is he doing? Samuel's hands moved. Precision, no hesitation. He separated the layers. Skin, galea, periosteum, need to access the temporal bone. He used the scissor tip as a makeshift surgical tool, scraping away tissue, exposing the skull. The depressed fracture, visible now. Bone fragments pushed inward. There, pressing on the dura mater. 3:28 p.m. 5 minutes in. Emma's pulse dropping. 60 beats per minute. Bradycardia worsening. Samuel muttered. Intracranial pressure critical. He worked faster. Used the scissors to carefully lift the bone fragment. Millimeter by millimeter. One wrong move, brain damage, paralysis, death. His hands didn't shake. Students watched, silent now, in awe. The janitor performing brain surgery in a school bus with scissors and a first aid kit. 3:33 p.m. 10 minutes in. The bone fragment lifted. Blood, dark red, venous blood, pooled beneath. Epidural hematoma, confirmed. Samuel used gauze, absorbed the blood, slowly, carefully, relieving the pressure. Emma's breathing changed, deeper, more regular. Intracranial pressure decreasing. 3:38 p.m. 15 minutes in. He checked her pupils. Left pupil constricting, right pupil dilating slightly, equalizing, brain herniation, reversing. He placed clean gauze over the wound, applied pressure, hemostasis achieved. 3:41 p.m., 18 minutes, sirens, ambulance arriving, paramedics rushed to the bus. We've got a 16-year-old female. They stopped, stared at Samuel, blood on his hands. Emma, bandaged, breathing. Who did this? One paramedic asked. Samuel stepped back. She has an epidural hematoma, depressed skull fracture. I performed emergency decompression. She needs immediate transport. Neurosurgical team, CT scan, possible craniotomy. The paramedic stared. You did what? I stabilized her. She'll survive if you move now. The paramedics didn't argue. They loaded Emma onto a stretcher, rushed her to the ambulance. As they drove away, sirens blaring, Mr. Harrison grabbed Samuel's shoulder. Sam, who are you? Samuel looked at his hands, blood drying on his fingers. I'm someone who used to be a doctor. Part 5, the reveal. The principal, Mrs. Delgado, arrived. Police, news crews. By evening, the story was everywhere. Janitor performs emergency brain surgery. School custodian saves student's life. But the students, the ones who'd thrown trash at his feet, they were silent, ashamed. One by one, they came to him. Mr. Sam, I'm so sorry. I didn't know. We were so mean to you. You saved Emma's life, and we treated you like garbage. That night, Samuel sat in the school parking lot, alone. His phone rang. Unknown number. Hello, Dr. Okafor. Samuel froze. That title. He hadn't heard it in 6 years. Who is this? Dean Richardson, Harvard Medical School. Dr. Okafor, we've been looking for you for years. Part 6, the past. Samuel closed his eyes. I'm not that person anymore. Samuel, we know what happened. In Lagos, with Amara, your daughter. His breath caught. It wasn't your fault. The investigation cleared you. The other surgeon made the error, not you. I was the supervising physician. I should have. You did everything right, but you disappeared. Why? Samuel's voice broke. Because I couldn't look at another child on an operating table. Amara was 16, the same age as the girl I saved today. And when she died, I couldn't do it anymore. So you became a janitor. I became invisible. I thought if I wasn't a doctor, I couldn't fail again. Silence. But today, you didn't fail. You saved her. Samuel looked up at the stars. Maybe I did. Samuel, the world needs you. Come back, teach, operate, save lives. I don't know if I can. You just did. Part 7, the return. 6 months later, April 2024, Dr. Samuel Okafor stood in front of Riverside High School, but not as a janitor, as a guest speaker. Auditorium packed, students, teachers, parents. My name is Dr. Samuel Okafor, he began. 6 years ago, I was a neurosurgeon in Nigeria, in London, in Boston. I performed over 3,000 brain surgeries. I saved thousands of lives. Silence. But I also lost a life. My daughter, Amara. She was 16. And when she died, I thought I was done. I thought I had nothing left to give, so I became invisible. I cleaned floors. I emptied trash. And you know what? Some of you treated me like I was worthless. Students shifted, uncomfortable. But that's okay, because you taught me something too. You taught me that titles don't matter. Degrees don't matter. What matters is what you do when someone needs you. Emma Chen needed me, and for 18 minutes, I stopped being a janitor. I became a doctor again, not because of my degree, but because I chose to act. He smiled, and now I'm opening a free clinic for families who can't afford neurosurgery, for patients other doctors say are too risky, and I'm inviting any of you who want to learn what it means to serve. Streaming, Dr. Sam, you're my hero. Samuel nodded. No, Emma, you are. You survived, and now you're going to do great things. Epilogue, 2 years later, Dr. Samuel Okafor's clinic had performed 112 surgeries, all free. Patients who would have died, now alive. 15 students from Riverside High became doctors, inspired by the janitor, who was a surgeon. And Emma Chen, she graduated top of her class, accepted to Harvard Medical School, pre-med, neurosurgery track. I want to be just like Dr. Sam, she said, because sometimes the person cleaning your floors is the person who can save your life, and the person you ignore might be the hero you never knew you needed.
This is the story of Dr. Samuel Okafor, the janitor who was a neurosurgeon, and the man who taught a generation what respect truly means.